ma'am, welcome to WION. Today we are discussing about the spread and outbreak of monkeypox virus. Although experts are saying that there is no need to panic, but due to lack of information, people are definitely worried. India has also reported some case now, and the main concern here is that people want to know how does the monkeypox virus transmit? How does it transmit from one person to another? And is there a way to prevent it? What do you have to say on this?
Thank you very much, first and foremost, for inviting me here on this important topic. Yes, WHO has announced monkeypox as a disease of emergency. So, emergency concern, so that the globe, all the countries can have a consolidated response to this. So, as we know, this is a pox virus, which is similar to smallpox. Smallpox got eradicated in 1980, and this is a similar virus which has now emerged. This virus was first diagnosed in 1970 in a 9-year-old boy in Congo. And the virus itself was identified in a monkey in 1957. That's why it gets the name monkeypox. So there is nothing to panic because the transmissibility of monkeypox virus is much less than what the current pandemic of COVID-19 we had. But because the world is still battling with COVID-19 and the memories are so fresh in our mind, it is very important that we play very intelligently this time. So this virus is a zoonotic disease, which means it is transmitted from animals to human beings and then from human beings to human beings. So animals which can transmit is monkey is one, other rodents can also be there. There may be some animal which keeps it as a reservoir, but that's not still identified. The main route of transmission is either contact with the infected animal, very close contact, not a very brief momentary contact, or contact with the infected person, either skin to skin contact or a very close prolonged contact through the respiratory droplets for some time. So that's how it is transmitted. So direct contact with the vesical fluid or with the respiratory secretions of an infected person or infected animal. Prevention is like, if we know the mode of transmission, then prevention is to avoid that. So first and foremost, avoiding contact with the sick animal in the endemic area, because it's mainly in the Europe and America this time. One. Secondly, anybody who's experiencing symptoms of fever, skin rashes, or lymph node enlargement should isolate themselves and get checked by the doctor so that it can be identified as early as possible. Avoiding contact, maintaining a good hand hygiene is of most important. Then when we talk about infections, then vaccine is another area we should explore. So there is no direct monkeypox vaccine available as of now, but there is a structural similarity with the smallpox. So smallpox vaccine provides 85% protection if it has been given in the last 20 years. So there are two vaccines which are currently available in America but not available in India. One is the ImmuneVab, which is a vaccine which is safe and found to be effective. And another one is ACAM, which is a smallpox vaccine. It is also effective, but it has some side effects. So both these vaccines are in very limited quantity and in limited part of the world. So there is a need to develop another more safer, effective and freely available vaccine. Immediately, there is no need to vaccinate the whole country, whole world, but maybe it can be considered for high risk groups or maybe considered for the healthcare workers. So monkeypox, as it's a viral infection, and mostly these are self-limiting. But monkeypox has two traits or two variants, you can say. One is a Congo Basin variant, which was basically with the South African outbreaks. It has a very high mortality of 10%. The other is a WA, which is a West African variant, which is the current prevailing variant right now. It has a lower mortality. The mortality is less than 1%. But yes, even 1% can be a huge number considering our population. So it can prove fatal in very small children or immune compromised people if it is not diagnosed on time, if the person is very, very immune compromised and goes into a multi-organ failure, situation. In those rare situations, it can go fatal. But with the current variant, it is not likely to be very, very serious or life-threatening. But we have to be careful. Practically, anybody who has not had monkeypox is at risk. But what we have observed in this outbreak is that out of 18,000 people worldwide, out of 78 countries, it has been found it is more in the male population, more in the sexually active age group, and more in the population which is like more MSM, man to man, the gay population. But we have to be very careful while we communicate, because we don't have to stigmatize this disease. Otherwise, many cases will go undetected. But any person who can have a close contact, skin to skin contact or respiratory contact, can get it. Even small children have been found to be having this infection. But more chances are in population which is sexually active and there is a closer contact. And the epidemiological evidence suggests that it is more male predominant right now.